And good afternoon, everybody, and welcome to Med Health and Wellness. My name is Frederick. I'm the nurse today, and we're here with Stat Lab, Dr. Love here, and we want to talk about his business today and some of the things he brings to the community. We're very proud to have you here today. I'm thankful for the opportunity to come out here and ask you a couple questions representing the people in the community. So just looking forward to getting some information about you and your company and some information you can share with the community about what you do. So without any further ado, let's go ahead and just get into it. First of all, Dr. Love, tell me about what made you want to get into this business and how long you've been doing it and what was it that got you here where you want to just go out on your own and do your own thing.
It really started off kind of a passion project. Everybody is aware of what occurred here in 2020 as far as the COVID pandemic. I actually had a child born during the pandemic, early in the pandemic, June of 2020. Just kind of give you a little personal story there. Child's born, comes on a Monday, Tuesday morning, we're diagnosed with COVID. So what do you do? I start going around trying to find someone to get us tested. I finally found a place that would test me in a certain part of Dallas, uptown. They were going to charge me $500 a test.
Wow.
So I immediately started thinking about, okay, myself, my wife, my children, my parents, I start going down the list. And as I'm going down the list, adding all this up, I'm like, you know what? This doesn't seem right with these costs. At the time, I was working in the biotech industry on the commercial side, which I've done for 15 plus years. So I'm familiar with the pricing and the process and procedures. $500 a test isn't right.
Wow.
The next several weeks, I went through the full gamut of the COVID infection, hallucinating, lost my sense of taste, sense of smell, all of that. I don't know, somewhere during all that hallucinating, I don't know, maybe a little anger involved too. I started asking myself if I thought I could test someone for COVID. I'm a respiratory microbiologist, immunologist. That's what my PhD's in. So anything in the pulmonary system is kind of like my bread and butter.
Wow.
Next thing I know, I made a decision, opened up my first laboratory here in Grand Prairie, Texas.
Okay.
And with that thought in my mind of being price gouged during this horrible pandemic, I think I was the cheapest on the block. I started off at like $135 a test. And honestly, man, listen, had you came to me during that time and told me you couldn't afford it, I still would have tested you.
Oh, right.
Maybe you're a positive control, whatever.
Right.
I would have found a way to get you the result. I did that. That was really a family affair. Me and my wife, we had some other partners at the time. It went very well for us. We impacted thousands in that community. Once that concluded, me and my wife kind of sat down, a lot of soul searching, a lot of praying. This is what we want to do. You don't get your PhD in micro because you like it. I mean, you get it because you love it.
Right.
And after spending all that time in these last couple of years back in the laboratory, I forgot just how much I did love it. So I don't know if that answers your question, but that's kind of how I got here. This is what I want to do. This is what I'm doing.
We appreciate that, man, and I'm glad to know that not only just it's a servitude behind that, which you saying like you would actually test these people regardless if they have money or not, because that was really important. And that just goes to show right there how much you really care about not just making money, but also about serving people, which is to me is the foundation of any business. If you're not in to serve people, then really you don't have a business being in business at all. So we appreciate that. So tell us about here. Now we're in DeSoto. You have a location here in DeSoto. Give us a little information about where you are, your time of hours of operation, and what you offer here to people in the community of DeSoto and
Okay.
South.
So I'm located right here off Bolton Boone. I'm right across the street from Methodist Charlton. Okay, the only trauma center here in the south side of Dallas.
Yes, sir.
My office hours we're here from Monday through Friday, 9 to 4. I have someone here actually sitting here. Now, I'm also available for after hours appointments or on the weekends. There are a lot of these services that I'm offering that are difficult to find on a Saturday, for example. Okay. And I offer the full gamut, and it's expanding. So I'm glad we have an opportunity to get some of my hardware in the image here. We opened up here, kind of a soft opening in February. During that time, we were doing our DNA testing as well as drug testing, dot and non-dot, any type of drug testing I can do. We started doing that. June is when we decided to really rev it up and go full time. So now we're offering the full gamut, or in the process of ramping up. I'm not sure if you can see behind me here, but I have my first piece of instrumentation here that's got installed that does CBCs for
Okay.
blood work.
Yes, sir.
Right here to your right I have my special chemistry instrument. It does things like PSA, vitamin D, testosterone, what have you. I have my urinalysis instrument here, soon to be installed, and then I have my clinical chemistry, soon to be installed here. We still do DNA testing, drug screening. I've recently launched an STD panel. So I'm not sure if you're aware, but right now the state of Texas is being hammered with STDs, especially chlamydia and gonorrhea.
Yeah, I heard it's rising.
Okay, so I'm a place you can actually come in here. I have a blood draw station actually. So you can come in, I can draw your blood, I can process it. And a lot of the testing I'm doing is being performed in-house.
Good.
So, Stat Labs is kind of catchy, but in actuality, it's really kind of our motto.
Yeah.
I believe that healthcare, the sooner I can turn around your result, the better result it's going to be. So oftentimes my goal is I want to be able to give you a result before you walk out of here. And that's what we're striving to do. Does that kind of answer your question?
Yeah, I love that because a lot of people who in the community really don't understand too, like the essence of the timing of getting these lab and the results back.
Yeah.
And sometimes special things with STDs, they may be having some issues at home. They need to get that rectified or may need to, whatever the case may be, getting those labs back are really important with the timing. The other thing I like that you talked about when you start talking about stuff like CBCs and some of these other things, most people in general don't understand what the CBCs and CMPs, what all they consist of or what they cover when you do those blood draws.
Okay.
So for the average person I hear who say, well, I just want to get my routine lab work that the doctor does, what would those labs be? Like the routine stuff that a doctor would draw just to check your levels and certain things that just say, hey, you're okay.
Okay, so if you're going to let's say you're going to your PCP, your annual visit, he's going to ask you to take some fasting labs, okay? He's probably going to have a blood draw taken, okay? He's going to take your CBC, that stands for complete blood count, and that's going to look at your total blood makeup, okay, and all the cell types involved in that. So you have, for example, red blood cells, you have white blood cells, oftentimes referred to as immune cells. You probably have more than a dozen of those, eosinophils, basophils, neutrophils, I'm not going to go
Yeah.
I could go on and on about
Right.
it. However, each of those cells type have a normal range. That CBC allows you to not only monitor every different cell type, but know if it's out of range. For example, if your immune cells were suddenly registering at a much higher level off the chart, chances are you're infected with something.
Yeah.
Maybe it's cancer. Okay, that increased immune response is reflective of that. Another test here that we're offering or soon to offer here, probably starting in September, is going to be our CMP. We're going to be performing those in-house. That stands for Comprehensive Metabolic Panel. And that looks for the things in your system like your potassium levels, your sodium levels, your chloride, a number of different, I think the name says it all, Comprehensive Metabolic Panel.
Real important.
Okay,
Real
very
important.
important.
Yeah.
In addition to that, we have a lot of other testing. For example, if you're a man, I'm not sure if you're aware, but prostate cancer is something that's very bad in our community.
Definitely.
Okay. You can see behind you, we do offer a PSA testing. That's
Right.
important.
Real important.
An ounce of prevention is worth a pound of cure.
I love it.
Okay. By the time you go into your doctor and you feel your prostate is swollen up like this fist, there's not much he can do for you. But to come by here once a year, take a test, make sure that you're in range. Hey, you just bought yourself another year. Well, not another year of life, but
Definitely.
it's definitely in your favor to have that information. And finally, we also have a urinalysis. Normally, when you go to your doctor once a year, he asks you to urinate. Okay, we can look at all those different things, your bilirubin, your specific gravity, your protein content, all of that. But your routine labs is something we intend to offer here same day.
So for all you people out here, the things that we offered here at Stat Lab are very, very important. Even if you don't have insurance or you don't understand what these labs are, it's really important that you actually get these labs because what these labs encompass, it gives you information on your heart, information on your liver, your kidney function, a whole bunch of things that's really important, even if you don't have a doctor. So coming here today or whenever you come here to Stat Lab and get these labs drawn, these things are really important. And if you don't even understand what the labs are that you're giving, the good thing about here at Stat Lab, they can explain to you when you're out of range, what these labs are, what you need to do, and then a recommendation that you go see your primary care doctor or get to an emergency room. It all depends on what the lab results are. So that's a really good thing.
That's correct.
One thing he did mention is that for people who don't have insurance, the out-of-pocket expense for these tests are a lot cheaper here than they are in hospital systems and everywhere else. And I'll let him elaborate on the prices of some of these things because I personally don't know them. but I just know from what I've seen in here that, and me working in the emergency room all these years, that these prices are a lot better for people who don't have insurance out of pocket pay than it is to go to the emergency room and pay for those. So if you want to kind of explain some of that with your pricing, or how that benefits them to come here instead of actually going to the emergency room where the cost is going to be a lot higher because they'll be charged emergency room charges as opposed to coming here and getting those same labs done here at Stat
You
Lab.
know, Stat Labs is not just a name. We are an actual laboratory, and our business model is a laboratory direct model. Okay, so you actually can come in here, and there is no doctor fee here. There is no emergency room fee, as you just mentioned. There is no blood draw fee. So oftentimes when you go to your primary care doctor and you come out of there with a $300-400 bill, when you look at the itemized copy, you realize you're being charged a lot of fees in addition to the actual test.
Right.
I'm only charging you for the test. Just kind of give you an example. You want to come in and be tested for HIV 1 and 2? Okay, $58. Now, I do take Medicare and Medicaid, but from all of my tests, I intend to offer a cash pay option. So for my STD panel that's recently launched, I think it's chlamydia and gonorrhea. I believe for that was the 20. I think it's roughly $120 for that one. HIV 1 and 2, I think it's $68. Also offer a test for herpes, syphilis, gonorrhea. I have several panels as well, which I've grouped a lot of these together. And by doing that, I'm able to really bring the cost down. But I have one called a complete STD panel, and it has everything. Hepatitis A, B, and C, herpes, HIV, syphilis, for the ladies, trichomonas. The whole point of this was to bring the cost down. I'm still that guy in 2020
Yeah.
that doesn't want to pay $500 for my answer. If the answer is wrong, then I can go to a primary care physician, but you want to be tested first.
Right.
And that's what we're doing here. Bring the cost down, Medicare, Medicaid, or self-pay option.
That's great. And for people who don't have insurance, once again, and I always say that because it's important, people who don't have insurance, it's still important that you do have access to some of the things that you can help address your health issues with. And getting your labs done at least once a year is very important, whether you have insurance or not. What those labs do, it can tell you about your different body functions, it can tell you about your different organs in your body, and it also kind of keep you up to par on where you're going as far as the trends in your health, overall health. So if you're coming in here once a year and getting all your routine labs done and your cholesterol level you have a set baseline foundation, you have something to work with moving forward. So if you come back the next year, 6 months later, and you see those numbers increasing, then you'll know that you need to make some changes in your life, and you may need to go to a doctor or whatnot. But having these labs is just so important, and we're so thankful that Dr. Love is down here in DeSoto, in the South down here, and offering these services to our people. The other thing that I like about this down here is that you're a people person. So when you come in here, you're going to get a friendly treatment. You're going to get treated like a friend or a family member. You'll be fast. And I see the Stat Lab. That Stat is actually real because they come in here, they get you taken care of and get you out of here in a timely manner. You don't have to sit in an emergency room and wait all day. You don't have to go to a physician's office and get 2 or 3 things done. When you just come right in here and get your blood work done, get your results back, and be on your way and get your explanation of what you're doing. So, man, we really appreciate that about you as well down here.
Thanks.
Most importantly, though, I'm glad you're down here because our people, I mean, just not a black and white thing. Everybody needs to be helped, but just you offering a service in our community where a lot of our people actually could use this information. We're all about health and wellness at the end of the day, and anything that we can do to help our people live a healthier, longer life, then that's what we're here to do. And I appreciate you coming down here and doing that. Also, Dr. Love is also a member of the DeSoto Chamber.
Yes.
And so that they have a lot of people that's connected in there, and we appreciate them coming out. I was at the ribbon cutting ceremony the other day. It was hot, but it was nice.
Yeah.
Yeah. We had a good time down here. A lot of people showed up, so that was an awesome thing there. And one other thing that I found really important is that, explaining to the people like what these labs are, and how these labs can affect them in a negative way. I mean, often we go to a doctor and doctor draw a lab, so we get lab results back and they say, well, your labs are okay. And that's it. Nobody really understands what all that stuff is really.
That's not helpful.
Yeah, that's not really helpful for somebody to say your labs are okay when really there's a lot of other things that really go into you going into a little more in depth with the labs and what they're for. So also, it's really important. Your STD panel is very important. The other thing that you didn't talk about, which is also really important, but I'm glad you brought it up, is that the privacy and the HIPAA, how important it is that we keep that privacy and information here within in-house. So people don't have to worry about any of the information getting out here. Whatever we do here, people sign for it, they're taken care of. There's no privacy issues here. The results are between you and themselves and the patients. And they get the results and they do what they want with it. So that's also really important. People are always concerned about, especially when it comes to stuff like STDs and HIV testing and stuff of that nature. So we do here take care of the people and keep everything private and keep everything, results between the people. So I love that about you. So.
And that's very, everyone's different. Sometimes I'll talk to some, they just want to hear it verbally. Some want me to email it or fax it over. But the point is, privacy matters.
Yes.
Your results for you, they're meant to be for you. They should only be with you. And if you choose to share them with your primary care physician or at whatever clinic, that's totally up to you. My job is just to make sure you get the highest quality result with the quickest turnaround time, because that's what A-plus healthcare really looks like. Okay, so that's what we're striving to do here.
And for the people out here also, we just want to remind you that your lab results, your blood work is just as important as your blood pressure and taking medications on a daily basis. I know we prescribe medications in the healthcare system. Me being part of the healthcare system as an ER nurse, we prescribe a lot of medications for people to take to maintain their health, but you can't really, every medication that you take, every procedure you get done, and everything related in healthcare is always backed up by lab results. And lab results are just not only good just to show you where your body systems are, but they're also good with showing the results of the medications that you're taking and showing the results of procedures that's been done and keeping people up to par on their health, on their daily health. So we're just glad that Dr. Love once again is down here serving our people in DeSoto with Stat Labs down here, and I'm very happy to have you. Matter of fact, I was telling you earlier about I had went to a lab place I think it was last year. I didn't have insurance at the job that I'm in, and I just wanted to get my regular routine labs like I do every year on my birthday. And I went to a place, and I can't remember what the location is, but I would have loved to spend my money with somebody in my own community who's here to serve me, who looks like me, who can explain things to me. And it's not a black and white issue thing with me, but it is good to have somebody down here to know I have somebody down here, one of my brothers, who can actually take care of the same thing and get me the same results that I need.
I'm glad you said that. That's probably one of the biggest personal joys that I've encountered or experienced being here. There's nothing like a patient coming in, having a dialogue with you. Listen, I'm not here to judge you. I might see you at church on Sunday.
Right.
The comfortability that we have with one another, I enjoy. I don't know. I'm just glad to be here. I feel like this is an area where hopefully I can have a large impact. And I appreciate you letting me come on here today. I'm trying to network with as many people from the community that I can to try to get the word out. And so far, I feel like DeSoto has just kind of welcomed us with open arms. Even like you mentioned earlier, the ribbon cutting last week. To see all these people come in here, it really very
it's a support,
heartwarming.
and I like being down here because the company, the government down here, the city of DeSoto, the people in the community, when they come out, they believe in supporting our businesses as they open up throughout the city. And also, once the people really, I don't know if people even know that you're open and where you're located, so this is also a good opportunity to kind of share information about that you're out here. So now people can, if they need some lab work done, if you're needing a lab work done or anything like that, you can look up Dr. Love and Stat Labs. He has a Facebook page, he has an Instagram page, he's all over social media. So, and we're located right here in DeSoto. He's not hard to find. So if you need anything for your family, and also don't forget that even if you don't have insurance, I keep emphasizing about the insurance. If you do have insurance, he accepts insurance, he accepts Medicare and Medicaid, private pay, whatever it is. Don't hesitate on coming in here and getting yourself taken care of. And other thing I love about having brothers like this in the community is that at the end of the day, not only are they here to make a living and make money, but they're here to help us out. So sometimes, the situations, you'll be able to address him if you don't have certain things, and you can work something out with Dr. Love and his family here at Stat Lab here. We're focusing mostly on just making sure that people are taken care of in the community. He's here to make money. He's also here serving our community, so we appreciate that.
Yeah, I'm glad to be here.
Yeah.